Hey folks, welcome back. We are joined by Banner Health's Dr. Gregory Golden. He is a pulmonary and critical care specialist. Doctor, thank you so much for being here.
Oh, it's my pleasure. Thank you for inviting me.
You got it. We wanted to invite you to talk about masks. In the pandemic, it's right now it's vital. And so let's kind of just briefly walk us through. First of all, do masks actually stop the spread of this virus?
Well, I think it'd be more accurate to say that masks greatly slow the spread of virus. It does that for lots of reasons. And there's lots of international data, lots of local studies done in the United States, lots of recommendations from societies that it clearly slows the spread of virus. It's confusing, and I'll fully admit this confusing. I can certainly understand why. In the very beginning, the CDC said, don't wear a mask. And they said, do wear a mask and don't wear a mask. And then they're back to wearing a mask again. And the reason it was different over time was because incidence changed. But now that incidence is high, there's lots of disease throughout the country, and we're seeing our friends, our neighbors, our grandparents develop significant disease, and some of them are dying. It's important to help slow the spread of disease significantly.
And what types of everyone's got different masks. Like I have this one right here. It's kind of cloth one that goes right. Is this the right mask to wear? Is there an actual correct mask to wear?
Sure. The correct mask to wear is whatever kind of mask you can get a hold of. The best type of mask for most individuals is going to be a simple surgical mask. Those are great. They're disposable. They're relatively cheap, but they do cost money and they only last for a little while. Most people are going to wear cloth masks. Those cloth masks can be obtained at the grocery store now. You can get them on Amazon. The instructions you can find on YouTube, the Centers for Disease Control website. It's what I wear when I go to the grocery store. Those work fantastic as well. They can be washed. You could use them, for weeks and weeks and weeks. After that, then you start thinking about less common types of masks. Some people are buying N95 masks. Some people are buying neck gaiters. Those things are fine too. They don't work quite as well. We do have some data now that people should not be using the purchase mask with vents on the side of them because they don't actually stop your body from getting virus load away from you onto your neighbors. They do a great job of protecting yourself, but they don't help anybody else. And the neck gaiters are proving to be less effective than surgical masks as well. So for most people, a surgical mask, and if not that, just a cloth mask is wonderful.
And quickly, doctor, and we've all seen this. I saw this yesterday in the grocery store. Someone wearing a mask, but it's below their nose. Now, what's the correct way to wear a mask?
Well, the correct way to wear a mask is very simple. If you think about your respiratory symptoms, the air is coming into your lungs and it's going out. And it's going to go out through your nose and it's going to go out through your mouth. And then since you, in theory, could have disease and not know it, that's what we're trying to stop, is the people that have disease and don't know it. You want to stop the spread of all the droplets, all those virus particles that are deep inside your lungs from getting onto your neighbors. So you have to cover your nose and you have to cover your mouth. If you're not covering those two things, especially when you're within 6 feet of a neighbor, then you're going to spread disease. So either you wear it correctly or it's not beneficial.
Dr. Gregory Golden, thank you so much. Great insight. We appreciate it.
Of course. Thank you for having me.
We'll see you next time.